CAP-assisted colonoscopy and detection of adenomatous polyps, CAP study, a randomized trial. The efficacy of colorectal cancer screening partly relies on the ability to detect and remove neoplastic polyps. However, approximately 1 in 5 adenomatous polyps may be missed, and missed lesions are likely to contribute to the majority of so-called interval or post-colonoscopy cancers. Improving the detection of all neoplastic polyps is, therefore, crucial to improving the quality of screening and surveillance colonoscopy. Withdrawal time is associated with increased adenoma detection and has become a main quality indicator for colonoscopy performance. In addition, recent advances in technology designed to improve visualization of proximal aspects of folds have shown promising results in lowering miss rates and improving adenoma detection. CAP-fitted colonoscopy is a simple technique that may allow improved visualization of the proximal aspect of colonic folds by flattening the fold within the viewing field. However, studies have reported mixed results on adenoma detection using the CAP. Some studies were limited by sample size and often included a small number of participating endoscopists. Other studies varied in the type of CAP employed or used polyp detection rather than adenoma detection as the primary outcome of interest. In a large trial from the Netherlands involving multiple endoscopists, CAP-assisted colonoscopy did not improve adenoma detection, whereas a smaller study from the USA involving 3 participating endoscopists reported a significant increase in adenoma detection when using the CAP. A recent Cochrane meta-analysis suggested that CAP-assisted colonoscopy increases overall polyp detection. However, no conclusion could be drawn with respect to adenoma detection. The authors concluded that further randomized controlled trials were necessary to definitively answer the question as to whether CAP-assisted endoscopy improves adenoma detection. The aim of the current study was to examine whether CAP-assisted colonoscopy improves detection of adenomatous polyps in a rigorous randomized trial design. The CAP-assisted colonoscopy and detection of adenomatous polyps, CAP, study included an adequate sample size, used the mean number of adenomas per patient as the main outcome of interest to best reflect whether a CAP is beneficial, and included a sufficient number of endoscopists in order to understand whether a potential benefit of the CAP would be independent of the user. Background and study aim. CAP-assisted colonoscopy has improved adenoma detection in some but not other studies. Most previous studies have been limited by small sample sizes and few participating endoscopists. The aim of the current study was to evaluate whether CAP-assisted colonoscopy improves adenoma detection in a 2-center, multi-endoscopist randomized trial. Patients and methods. Consecutive patients who presented for an elective colonoscopy were randomized to CAP-assisted colonoscopy, 4 mm CAP, or standard colonoscopy performed by one of 10 experienced endoscopists. Primary outcome measures were mean number of adenomas per patient and adenoma detection rate, ADR. Secondary outcomes included procedural measures and endoscopist variation. A logistic regression model was employed to examine predictors of increased detection with CAP use. Results. A total of 1,113 patients, 64% male, mean age 62 years, were randomized to CAP-assisted, N = 561, or standard, N = 552, colonoscopy. The mean number of adenomas detected per patient in the CAP-assisted and standard groups was similar, 0.89 versus 0.82, P = 0.432, as was the ADR, 42% versus 40%, P = 0.452. CAP-assisted colonoscopy achieved a faster cecal intubation time, 4.9 versus 5.8 minutes, P less than 0.001, a similar cecal intubation rate, 99% versus 98%, P = 0.326, and a higher terminal ileum intubation rate, 93% versus 89%, p less than 0.028. Cap-assisted colonoscopy resulted in a 20% increase in ADR for some endoscopists and in a 15% decrease for others. Individual preference for the cap was an independent predictor of increased adenoma detection in adjusted analysis, p less than 0.001, whereas baseline low adenoma detection was not. Conclusion: although the efficiency of cecal and terminal ileum intubation was slightly improved by cap-assisted colonoscopy, adenoma detection was not. Cap-assisted colonoscopy may be beneficial for selected endoscopists.